The Life After 50 show, helping you navigate the second half of your life. Today's show is sponsored by Find Houston Senior Care, your one-stop shop for everything senior care and senior living in the greater Houston area. Visit findhoustonseniorcare.com today. And now, here's your host, Catherine Watson.
Hey, everybody. I'm here today for the Life After 50 show, and I've got a guest that I think you're going to be very interested to hear from. Her name is Lizette, and I'm going to let her tell us a little bit about herself in just a minute. But we're going to be talking about dementia, but a little bit different twist. We're going to be talking about the newer research about what to do to decrease your risk of developing dementia. Now, I know a lot of my listeners are caring for somebody with dementia. So this is really heavy on our minds, Lizette. We think about this a lot. We want to make sure that we do everything we possibly can to not have that same fate that we're seeing in the people that we're caring for. And we want to do the best we can for them as well.
Absolutely.
So I'm excited that you're here to talk to us. If you would just tell us a little bit about your background and how you came to do what you're doing with helping people think differently about dementia.
Well, thank you so much, Catherine. My name is Lizette Cloete. I am an occupational therapist by background and training. However, this last year, I started a dementia consulting and dementia specialty company where my emphasis is on working with people to actually decrease their risk for developing dementia. I have been in the United States since 1993. My husband and I emigrated here from South Africa. My degree is actually from South Africa, so my background's a little bit different, which always helps because I bring a different spin to things. We live in Greenwood, South Carolina, and I have a passion for people with dementia, mostly for a lot of different reasons. But one of the biggest reasons is in my later years, my grandmother did have dementia. And it was very frustrating living in the United States and knowing that she was going through these changes and not really being able to help her. And then my mom also has vascular dementia. She had a stroke in her early 40s and has had multiple changes over the years because of her stroke. And she's definitely had other strokes. And so over the past several years, I've started to really become more interested in what can we do to actually decrease our risk for developing cognitive deficits ourselves. There is a tipping point. You know, you don't want to wait too late to get started, although the research does show that even in later stages of dementia, you can have some improvement if you do some of the right things, but obviously the improvement's not going to be as big as if it is when you start to notice that you're having trouble with your thinking. So I just turned 50. So I'm looking at this. I'm like, Life After 50 show. I'm in the right spot.
Okay.
It was kind of fun. So actually the research shows that, and I find this very interesting, that your cognition continues to improve until about 25, and then after about 45, it starts to decrease. So any of us over 50, we've got to start paying attention.
So we've got to work a little bit harder. That's all that is. And, you know, it's no different with our physical bodies.
No.
You know, the things that I could do in my 20s, I can still do them, but it might take a little more effort on my part, a little more working at it. It's no different with our brains, right?
Correct. So the question on the screen there, is there anything you can do if you already have been diagnosed with dementia or cognitive impairment? Yes. There are things that you can do. And always it's going to depend on where we start in the continuum. If you want to think about it as a continuum, you know. So I'm going to start we'll start with normal. Okay. We'll say we starting normal. Then there's a period of time before people start to have trouble that can last about 10 years, and that's called subjective cognitive impairment, which means I notice that I'm having trouble, but if I take a test, the test isn't showing that I'm having trouble. So we're able to compensate for it. That's the best time to start working on your thinking, because the permanent changes haven't occurred yet. That phase can take up to 10 years. Then there's the first diagnostic, or the first phase, that's called mild cognitive impairment. So that's technically a pre-dementia phase. If you just want to go off of the medical model, a pre-dementia phase that can last up to 5 to 7 years. So almost 20 years before, 15 to 20 years before a diagnosis of dementia, people are actually starting to show changes.
Absolutely.
So the earlier we can get started in our 40s and 50s to make the right changes, then we can prevent some of these things that we're seeing. And then you have your mild, moderate, and severe dementia. And obviously, the further along you are in the spectrum, the harder it becomes to reverse it. So does that help to know that there actually is something that you can do?
Absolutely does help. I think anytime you can give people hope, and that there's, I think so many people out there need this and want to hear about this. So tell us, what kinds of things can we do?
I hate to say this, but they're right. Diet and exercise.
And, studies have been showing that.
Yes.
We've been seeing more and more studies coming out showing diet and exercise is key and critical. And in this last year with COVID, I've noticed two things. My diet has gone down the tubes, but my exercise has gotten better.
That's
because
good.
I'm getting outside more. I've always been a walker, but I'm walking more. Where I was maybe walking once a day, I'm walking twice a day, and I'm taking longer walks and that sort of thing. And so I'm getting out a little bit more. And I notice my neighbors are out more, because I used to walk and not see anybody.
Right.
And now I see lots of people. So that's
I can't go to the gym anymore.
Yeah.
So the newer research is actually showing that there are up to 36 contributing factors for dementia. Up to 36.
Wow.
But there's three primary things that come out: inflammation, nutrients, hormones, the stuff that we put in our body, and then if we have hormonal changes or fluctuations. And the third one is toxicity. So of the three, some people have one, some people have two, some people have all three. And so the one with the inflammation, so I've been doing a lot of reading, and all of the people that are the researchers that are doing the research on this, they come back to the following three things: inflammation, and blood sugar falls under inflammation. Okay. What you're putting into your body, what we eat, what we drink, and then our own hormones. And then the third one is toxicity, things like mold, things like amalgam or mercury in our teeth that are poisoning us, which can poison our brain. All of these kinds of things. And most of the prominent people that are talking about this, the way they treat it is through diet, exercise, stress, and sleep. Those four things. They call them different things. One's called metabolic, metabolic mind, metabolic inflammation, nutrition, and drugs, not illicit, but medication. And it's very interesting that the more I research myself and the more I read myself, that one of the most under recognized reasons, and please, I don't want people to think Go out and stop taking your medicine. I'm not saying that. But one of the most under-recognized reasons for people having cognitive changes are actually medications, drugs. A lot of drugs have a side effect that actually affects our thinking, and
Yes,
we don't think
absolutely.
about it.
I definitely believe that.
Yeah.
And, I think that's something. And so many of our seniors are on more medicines than you can shake a stick at. They've got a whole, you know, basket full of medicines that they're taking. And it's just
15,
too many.
20. Yeah,
I
it's
had a
crazy.
pharmacist on the show last year, and she called. She talked about the Houston cocktail, and I
Mhm.
said, "What is that?" And she said, "Well, she said it's kind of a name us pharmacists have given to the cocktail of drugs that are commonly given to elderly people."
Ambien, Xanax.
Yes, I think those were the ones on there. Yeah, and she said, and they cause a lot of the problems that they're having with their cognition.
Right.
And because of that, it also will cause problems with balance and
Yes.
those
And
sorts
then
of
they
things. So then
fall,
you have
and then they break
fall,
their
and you
hip.
end up in the
Yeah.
hospital, and it's just this cycle that goes over and over and over.
Right.
So,
I actually had I do a little hour-long Facebook Live on a Saturday on a large dementia group that I'm on. And I have started doing this just the last couple of weeks. And I do it kind of very organically. I hop on and I tell them I'll be there for an hour and I ask people to ask me questions. And one of the questions that came up this week actually had to do with this, where they said that their loved one is now on hospice. Hospice took them off of all of the medication they didn't
they're
need
doing
anymore,
better.
and they got better. Their thinking got better. Now, is she going to hop up out of bed and, be fine? Probably not. But at the same time, we've got to start asking ourselves these questions. Why are we putting these things into our bodies? So let's
Mhm.
talk about Namenda and Aricept and things like that, because I know people out there are going to ask this question. So one of the experiences I've had, both as a therapist, as a clinician, and as somebody that has been looking at this and researching this, is that a lot of these medications do not work. They work maybe a little bit for some people some of the time. And when
Mhm.
you go and look at the reasons why, I said at the beginning, there are up to 36 different reasons for people to develop dementia or cognitive impairment. And medication plugs one or two of those holes.
Mhm.
And there's still 34 other reasons why they're having trouble with their thinking. So the medication it's a monotherapy. It's a one thing. And then you go to the doctor, and this is why I want to do these kinds of talks, because you go to the doctor, or a family member goes to the doctor and they're having trouble with their thinking. And, doctors are seeing 50 patients a day. They have 10 minutes to see someone. They don't have the time to sit there and really talk to the person and see they're struggling with this type of their cognition, or this type of their cognition, or this is a problem versus that. And then, what do family members want? They want a way to fix it. Well, a medication, a prescription, here, go fix it. Well, it
Right.
doesn't fix it.
It doesn't fix it, and sometimes it can make it worse.
Right.
And, Lizette, one thing I'd like to point out too, a lot of your family doctors, your internists and all, they're not really trained
No, they're
to
not.
understand and to diagnose dementia.
Right.
My mother-in-law was a prime example. Her family doctor that she went to, um, we brought in a list of like 4 pages of bizarre behaviors that she'd
Right.
had, and things like getting lost in a town that she'd lived in for over 50 years, and all of these different things that had happened that really should have raised some huge red flags
Mhm.
for him. She also, we found out when we went there, had missed several appointments and had shown up on days that she didn't have appointments.
Yeah.
That should have been some red flags.
Massive red flag.
But the doctor gave her a small little cognitive test And as soon as he told her he was giving her a test, she did what I call pull the big girl panties out. She straightened up in her chair and she was not going to flunk that test.
Mhm.
And she answered every question perfectly. And he said, well, I just don't see that there's any problem with her.
Right. So let's talk about those
Yeah.
tests real quick. That's really interesting. So I have access to probably the tests that they did there. And you bring out a very important point. Doctors, general practitioners, and I even want to say neurologists and people who do this, unless they specialize in dementia,
Yes.
they don't necessarily, they have to stay on top of everything, right? So
Mhm.
they have to stay on top of everything, and they cannot know everything about everything. They're a jack of all trades, and I love them. I work with them. I'm not
Mhm. They're
dissing
great.
doctors. They're great at what they do. For UTI or to send you to the right doctor because you're having heart problems or whatever. But dementia is so slow, it's so pervasive, and it really is it's something. Yes, the mini mental test is something that you can do to screen somebody. But you know what? If you're having a good day, or if you're still at the point where you can compensate, and she knew she was being tested, you can pass a test and still not be able to function, because
Right.
that's where there are some newer tests. One that I do is called the brief cognitive assessment test. It is a licensed test. You cannot just, the mini mental is a very down and dirty, gets you into maybe the ballpark, but it is not a test truly to screen somebody for dementia. The brief cognitive assessment test is one of them. It is a licensed test. It's more a screening. It's not really a test per se. It takes about 20 to 25 minutes, but it is sensitive and it is normed to distinguish between mild cognitive impairment, mild dementia, moderate dementia, and severe dementia. So it
Mhm.
actually gets you into the ballpark of, yes, this is truly a problem. It can also show you whether, sometimes people, like I had a patient today, she does not have dementia, but she had COVID. So I went to go see her. I work in home health, and she went home after her COVID. One of the things we're finding with people with COVID is it can affect their thinking or their memory. And so I did a quick screening. It's not even a test. It's just a 6-question screening. But it is sensitive to see somebody's got normal cognition, or they're starting to have trouble, or, oh gosh, I fell off of the bus.
Mhm.
Houston, we have a problem, right?
Right.
So she tested in the questionable range. Well, the brief cognitive assessment test actually has a way of picking those people out and saying that this is probably likely due to something acute, like an infection or
Mhm.
a delirium because you've been in the hospital. There are lots of reasons our thinking changes. So I like to do this as a screening for people to really start to see, do they actually have dementia? Because unless you have a doctor who's going to sit there and take the time to listen to the family, because the family is either one of two extremes, like you guys, where you were sensitive and picked up on it, or mom's fine.
Mhm.
There's nothing wrong with mom. I would just like to point out, you mentioned this, so I'm just going to point it out. If mom or dad lives in a town where they've lived for 70 years and they get lost driving in town, that is a sign we need to do something,
Mhm.
because that is not normal. Cognitive changes, to the extent that we see, is not normal aging. And that's the other thing people say. Oh, it's just normal aging. It's normal to forget things because of its normal aging. Well, to an extent, we all forget some stuff. So, what's the difference between not remembering something or short-term memory deficits and being
Mhm.
forgetful, right? They're two totally different things.
Right.
So being forgetful is this. Like, we talked a little at the beginning, you're getting ready to move and you've got all this stuff going on, and we have what's called working memory. If you want to think about working memory, it's a little place where we put information in short term before it goes into short term memory. It goes into our working memory, and we can store 7 to 8 to maybe 10, if we're having a really good day, short pieces of information in, so that we can plan, organize, and do things, right? So you're trying to pack and move, the phone rings, you get distracted, your husband starts to talk to you about something else, the dog wants to go out, and you have all of
We're
this stuff
working.
happen, right? And then you come back and say, well, what was I doing? Right? What was I doing? I forgot what I was doing. And you stop and say to yourself, okay, well, the phone rang and all of this stuff happened, and right before that oh yes, I was packing up this box. This is what I was doing, or I was making this phone call to arrange this thing. That's forgetful. That's how we forget where we put our reading glasses down, because we get distracted. We have other things come in, and all of the other things, if they're more important, will kick out the things that are not as important. So that's forgetful. We all are forgetful at times, and forgetful can be very impairing, but it's not a deficit per se. The difference between that and memory problems is the same exact scenario, and your husband says to you, but you're packing that box because we're moving, and you're like, we're not moving.
Mhm. That would be a problem.
That would be a problem, right? So when we are able to put ourselves back into the situation and work our way back from, we all did this when we had kids. You're brushing your teeth.
Mhm.
They come in, mommy, I need help with whatever. You stop, you do what you're doing, you go take care of the kid, you come back, and it's like, what was I doing? Oh yeah, I was brushing my teeth. So you take yourself back to that situation, and when you're able to then recall that, that's normal forgetting. We all forget things. Nobody has perfect recall.
Mhm.
The difference is when you cannot remember things, it's like, oh, it didn't happen. It did not go in at all. So yes, there is a big difference between the two. But even if you're having trouble with your memory, there are things you can do to improve it.
So let's talk about that again.
Yes,
Let's
ma'am.
go back to that. What are we going to do? We're going to exercise and we're going to get a good diet.
So the four most important things, that you can do, that you can control, that you can change immediately. Diet. And the research is showing, when I look at all of the diets that they have researched and that they say, they have one thing in common. The thing that they have in common is actually very, very limited sugar. So two things. So the ketogenic diet is one of them. High fat, low carb, moderate protein diet has actually shown the best. Um, the other one is a gluten-free diet, because gluten-free diets tend to be, if you look at them, higher healthy fats,
Mhm.
lower carbohydrates, and good healthy meats, right?
Right.
Very little pasta, very little or no pasta, no bread, no things like that. One of the doctors who researches this wrote a book called Grain Brain, and
Mhm.
it's a
I'm
great
familiar
book.
with it.
It's a really good book for people to read. I think it's the easiest one to implement if you want to do it yourself, because it's really a ketogenic diet that's gluten free. Because the challenge when you go gluten free is then you replace gluten with other things like rice flour, potato starches, whatever, high carb. So
Mhm.
if you do the Grain Brain, where you stay away from those kinds of things, but you still follow the ketogenic type of lifestyle. The other one is the Mediterranean diet. So what does
Mhm.
that have in common? Typically, those people tend to have a higher fat diet. They eat a lot of healthy fruits and vegetables, lower glycemic index, and healthy, moderate alcohol. consumption, some wine. Wine has good benefits. Gone the wrong way can go the wrong way. And good healthy meats. So when you compare the diets, and it's like, well, the Mediterranean diet and the ketogenic diet and the grain-brain low carb, the grain gluten-free diet, they don't sound like they're the same, but to a large extent, they really have a lot in common. And the thing that they have the most in common is low sugar. So one of the biggest factors, pre-insulin or pre-diabetic, high A1C equals dementia in the future. They're also calling dementia nowadays diabetes type 3.
I have heard that. Yeah.
So my transformation started at the beginning of the year because my A1C started to creep up. It never got over, but it was borderline. And I'm like, you know what? You are not healthy. You're not exercising. You're not sleeping well. You're stressed out of your mind. And your A1C is creeping up. And then I started to do all of this stuff. And I'm like, oh, we can do something. So that takes care of diet. Then the second part of it is exercise. So there a lot of different types of exercise. One of the researchers has shown through research, if you do isometric exercises, which is a plank is an isometric exercise. So you're not moving the muscle itself, you're holding yourself. So if I go like this and I pull on my hands, that's isometric. If I push on my hands this way, it's isometric. So if you do 6 minutes of isometric exercises per day, it helps your brain.
Really?
Yes.
I didn't know that. So, I got to learn more about that.
150 minutes of exercise per week, which works out to be about 30 minutes of moderate to brisk exercise a day. Cardiovascular exercise has shown good results for increasing your thinking. So walking briskly is good, even though weightlifting is good too for other reasons. I think it's good to combine the two, but 30 minutes of brisk, moderate exercise per day is what is recommended. 150 minutes per week will help your brain. So that's the physical exercise.
Go over that again, because I want to put that up on the screen. I don't think a lot of people know about the isometric exercises. 6 minutes. What did you say?
6 minutes of isometric exercises.
Does what?
Helps stimulate your brain. It helps actually increase the blood supply to your brain. So isometric exercises, so if you're sitting in a chair and you squeeze your butt cheeks together because you want to, work on that's an isometric exercise. So you're not actually moving. It's not like you pick up a weight
You
and
can
do
do that while you're working.
Yes, you
You
can.
can do that while you're doing anything, just about.
Right. A plank.
I love that.
A plank is an isometric exercise.
That's brilliant.
Yeah. So 6 minutes of isometric exercises a day can help your brain, and then 150 minutes of moderate walking brisk exercise per week has shown through the research to make a difference in your cognition. And one of the guys, I loved this. He's like, you can trick your brain. You can use your brain to trick your brain. And how you do this is because, I don't know about you, but I'm really good at convincing myself not to do something. Right? It's like, okay, I don't have an hour to go exercise, or I don't have 30 minutes to go exercise, but I have 5, right? So go and exercise for 5 minutes, because the moment you start to do that, you release endorphins and things like that, which are the feel-good hormones. And guess what? Then your brain all of a sudden says, oh, I feel good. Let's do some more. And then you can trick yourself into doing it. So even though you don't feel like exercising, go exercise. Tell your brain, we're only going to do this 5 minutes, because your brain will say, okay, I can do this 5 minutes, right? So trick your brain into exercising by going and just doing it. And then after 5 minutes, you're going to say, oh, but this doesn't feel so bad. Let's do another 5, or let's do another 15. And you can build yourself up that way. So you don't have to start with, 30 minutes a day, but trick yourself and make it a habit. So a great way of doing this, it's called tiny habits. And I did this with myself as well. You want to add a new habit to something that's established, right? We all have routines. So my new habit is I fell off of the truck when I turned 50 and I got sick. I still have a little congestion, but I started it up again this morning. So everybody has routines. So my first morning routine is I got to go potty. So after I go to the bathroom, I come out and I go do a plank. And I say to myself, 30 seconds. You can do it for 30 seconds. And so it's been hard because I'm not very fit. And I hold it as long as I can. And then right after that, that was the new habit. So going to the bathroom, doing the plank was the new habit. And I have a habit of drinking a glass of water in the morning, because water first thing in the morning we dehydrate overnight. And if the first thing that you drink is a glass of water, you help rehydrate yourself. If you drink coffee is a diuretic and it actually dehydrates you. You're not hydrating yourself. You want to drink water. So my other habit was drink water. So go to the bathroom, I do my plank, and then I drink my glass of water. And then after that, I do sit-ups. And then I do my shower. So I anchored those new habits to something that's established. So my other new habit is, like, when I drive home from work, instead of driving home, I drive to the gym. That's the new habit. Even if I don't have time to work out and I go for 10 minutes, I drive to the gym, because once I'm there, I will work out even if it's for 10 minutes. To change a habit, so you want to anchor it. You want to anchor a habit to something old. So a new habit goes with an old habit. So that's how you can add exercise into your life, is by anchoring it, even just doing your isometric exercises.
I love it. I love it. I'm going to take that one away and just do that. I mean, I was
even for a minute,
while we were talking and doing
it. So even for a minute, you add something. You watch a specific TV show every night. When they're doing the whatever. Right. Oh, I'm going to do my isometric. You add it to something you do routinely every single day.
Right. And isometrics is something I had forgotten all about.
Right.
I'd really just forgotten about that type of exercise.
So that's the physical exercise. Then we're going to talk real quickly, briefly, about cognitive exercises, because we can cognitively work on our thinking processes. So there are two types of things. We all are creatures of routine. I know for sure I am, right? So we all have habits and routine. Now, when you're losing your ability to problem solve and so on, routine is your friend. We want to keep you in a very structured routine. We want you to get up at the same time every day. We want you to have a very structured routine. Right. But routine is not good for thinking. We don't have to think when we're doing anything routinely. So some lifestyle hacks is do things with your non-dominant hand. That you would routinely do with your dominant hand. For example, brush your teeth. I'm left-handed, so brush your teeth with your left hand. Okay, fine. I can do that all day. I don't have to think about it. Now brush your teeth with your right hand. Now
it's really hard to switch. It really is. I've done that.
It's novel and different.
Yeah.
So cognitive exercises have to be novel and different. So a lot of people will ask me, well, I like to read. Well, great. I love that you're reading. Reading is not a cognitive exercise unless you're actually having somebody ask you questions afterwards. Because you can read, I don't know about you, I read fast, right? I can read a whole bunch of information. I have the gist of it, but I don't have the details, right? or a somebody who has done word games their entire life, right? So you give them a crossword puzzle. My mom is like this, actually. She's a Scrabble queen. I still cannot beat her at Scrabble. But it's because it is such a routine and familiar task for her. She really isn't using her thinking. She's doing it on autopilot. So numbers, if you're a reader, then you want to do number games. If you're a numbers person, you want to do a reading game. But it has to be novel and different.
Different.
Totally, totally different. There are lots
I'll ask you this. I go for walks every day. I think I told you that. And I try to change up my routine because I've heard that that's important. So rather than just go the same direction every morning and the same route, I try to switch it up a lot. Is that something that's beneficial?
I think it's beneficial. It's not really going to change. It's not really working your brain per se.
Okay.
But there are other exercises, cognitive exercises that you can do for that. There are two great websites for people who are truly interested. One is called Lumosity. Have you heard of Lumosity?
I've heard of it. I haven't been there, but I've heard of it.
And I think it's Lumosity, lumosity.com. And then the other one is Brain HQ.
Okay.
So those two, and I also think it's .com. So those are some subscription-based cognitive websites that people like me who do cognitive training with people I do cognitive coaching for people who have either subjective cognitive impairment or even up to a mild cognitive impairment that want to see if they can reverse it. I will do individual cognitive coaching with them and work through the diet, the exercise, the sleep, and all of that. I have some other tests as well that I can do that are more normed and standardized. But it's a lifestyle thing. You've got to change your lifestyle. It's not you can't just sit back and say, woe is me. And so so those two websites are great places for you to do some cognitive training. And they're actual games, but they're cognitive games. They're not that they work on response time. They work on all of those kinds of things. Then sleep. Sleep is extremely important. We don't sleep enough. And a lot of medication we take to go to sleep affects our thinking. And so people need, for each sleep cycle, it takes about 90 minutes. People are a little different, but on average, each sleep cycle is 90 minutes. So you want to sleep in 90-minute increments. So 8 hours really doesn't help. It needs to be 7.5 or 9. Most people sleep about 7 to 7.5 hours a day. It's more important to get up at the same time every day. Doesn't matter what happened the night before, then it is important to go to bed at the same time. But if you cannot, you want to make sure you still get up first thing in the morning at the same time. So a lot of people who are probably listening today have loved ones with dementia, and they probably struggle with their sleep. So here was a little trick that you can do. We need sunlight. First thing in the morning, after you do your morning routine and so on, you want to make sure people are resetting their circadian rhythm by getting sun. So when you go out in the morning and walk, you're resetting your brain saying this is daytime, right? And then what happens, and I work in home health, I go into people's houses and they're like, Mom doesn't sleep at night. And I'm like, yeah, I wonder why. It looks like it's night in your house.
Like a dungeon, I know.
10 o'clock in the morning. How do you expect her to know this is daytime? And then the TV's blaring. Open the blinds, put some sunlight on. There's light therapy. There are specific light boxes that you can buy. You want to take them away about an hour and a half before you want them to go to sleep. Melatonin for elderly people can actually make them cuckoo for Cocoa Puffs. So you got to be careful with melatonin.
Melatonin did not work for me. I tried it.
Yeah.
Even when I was younger, and it did the exact opposite.
And that happens. That absolutely happens. Yeah. And so you want to, so one of the doctors has what he calls a banana tea. Magnesium helps people sleep. So bananas are full of magnesium. And so what they do is you cut off the ends of the banana and you steep it like you're making tea for about 3 to 5 minutes. Once you're done, you don't eat the fruit because a lot of the magnesium and nutrients are actually in the peel and not in the fruit itself. So you just boil it. You wash the banana beforehand, but you boil it and steep it, and then you throw the fruit away, and then you take a little bit of honey and cinnamon or whatever, and you make yourself a tea about an hour before you want to go to bed. Drink banana tea and see if that helps you sleep.
That's interesting. I'll have to try that. Lizette, I hate to do this, but we are past time.
I know. Last one is stress.
Back again. That is absolutely a must because you're a wealth of information. I want to make sure that people know how to get in touch with you.
Yes.
Hold on a minute. Let me pull up a. Okay. So if you want to contact Lizette, what is the best place? Where do you want us to send them?
thinkdifferentdementia@gmail.com. So Think Different Dementia is the name of the company, of my company that I started. And I'm on Facebook. I have a Facebook group also called Think Different Dementia because I want people to think differently about dementia. I want people to think that there are things that we can do. That's why I decided on that name. So Think Different Dementia.
That's correct. Think Different Dementia @gmail.com. That's how you contact Lizette. You can also go to her website, which would be thinkdifferentdementia.com.
I don't know yet. I haven't got my website up all the way.
Okay, but you do have a Facebook group they can join. Called Think Different Dementia. So if you're on Facebook, up in the search bar on the top left-hand corner, just type in Think Different Dementia and the group should come up, or go into groups and search for it there.
And email is the easiest. I will answer everybody's email. I'm great with email.
Wonderful. Well, Lizette, it's been a pleasure to have you on. We didn't get to have the questions I had because we kind of went off in a different direction, but that's okay. That's what we needed. And you just had some wonderful information that I know our readers wanted to hear. And I especially am going to be doing a lot of those isometric exercises. In fact, I'm sitting here right now, I'm doing 2, one with my hands and I'm squeezing those buttocks.
There you go. Oh, and that'll help for urinary incontinence too.
Oh, wonderful. That's always good. All right.
Ma'am. Well, thank you so much, Catherine. I appreciate being here.
Thank you. I appreciate it. And you have a wonderful day.
You too.
Bye-bye.
Bye.
Welcome to the Life After 50 show, helping you navigate the second half of your life. Today's show is sponsored by Find Houston Senior Care, your one-stop shop for everything senior care.